Privacy, confidentiality, and security. Outlines. Privacy. What's privacy health information? Who has to follow privacy? Where is privacy health information found? Privacy and patient rights. Confidentiality. Guiding principles of confidentiality. Security. Importance of security. Tips to protect patient confidentiality, privacy, and security. Privacy. Privacy is viewed as the right of the individual client or patient to be let alone and to make decisions about how personal information is shared. People have the authority to determine what information to share, with whom, and how. Privacy, the right of individuals to be left alone and to be protected against physical or psychological invasion or the misuse of their property. It includes freedom from intrusion or invasion into one's private affairs, the right to maintain control over certain personal information, and the freedom to act without outside interference. What's privacy health information? PHI. PHI stands for Protected Health Information and includes demographic information that identifies an individual and is created or received by a healthcare provider, health plan, employer, or healthcare clearinghouse. Relates to the past, present, or future physical or mental health or condition of an individual. Describes the past, present, or future payment for the provision of health care to an individual. Who has to follow privacy? Anyone who currently works directly with patients, currently sees, use, or share PHI as part of their job, currently access any hospital systems, records, tools, and information that may contain PHI. Where is privacy health information found? Medical records, patient information systems, billing information, bills, receipts, EOPS, explanation of benefits. EOPS provides details about a medical insurance claim that has been processed and explains what portion was paid to the healthcare provider and what portion of the payment, if any, is the patient's responsibility. Test results, X-rays, clinic lists. Labels on IV bags. An IV medication label should supply patient information including the drug name, current dosage, and any precautions. These labels may also be used to provide information about additives included in the given solution. Patient menus, conversation, telephone notes in certain situations, patient information on a mobile device. Need to know. Employees should only access the minimum necessary information to perform their jobs. Privacy and patient rights. Right to access any information contained in their medical and billing record. Right to amend. Patients may request in writing an amendment to their medical records if they feel it contains incorrect or incomplete information. Right to request special communications. Patients may ask BMC to contact them via an alternative phone number or address. Bulk mail center over-the-road container, obsolete, a highly mechanized mail processing plant that primarily received and distributed package services parcels in piece and bulk from and standard mail parcels in bulk form. All PMCs were converted to network distribution centers by 2010. Right to request restrictions. Patients may request not to be included, opt out, in the dictionary. Patient information should not be shared with clergy, friends, or anyone. Right to file a complaint. Patients have the right to file a complaint without fear of retaliation. Right to receive a notice of privacy practice. To provide a written notice of how we will use and disclose our patients' health information. Confidentiality. Confidentiality in healthcare refers to the obligation of professionals who have access to patient records or communication to hold that information in confidence. Everyone in an organization is responsible for patient confidentiality. Confidentiality ensures that individual health information is used for the intended purpose only, and that patient consent is required for any disclosure. List of patient information that must remain confidential: identity, name, address, social security, date of birth, physical condition, emotional condition, financial information. Guiding principles of confidentiality. Access patient information only if there is a need to know. Discard confidential information appropriately, for example, locked trash bins or shredders. Forward requests for medical records to the Health Information Management Department. Do not discuss confidential matters where others might overhear, for example, cafeteria, elevator, buses, or restaurants. Do not leave patients' charts or files unattended. Security. Security refers directly to protection and especially to the means used to protect the privacy of health information and support professionals in holding that information in confidence. Security is protection of your personal information. Security, the means to control access and protect information from accidental or intentional disclosure to unauthorized person and from alteration, destruction, or loss. Importance of security. When we protect patient data, we help build trust between patients and providers. Ensure protected health information, PHI, is not disclosed to an unauthorized person. Do not send email containing protected health information, PHI, unless it's encrypted. Log off your computer if you have to leave your workstation. Passwords are only effective if they are never shared and follow the guidelines for creating a strong passwords. Do not share your password with anyone, including coworkers, supervisors, or the help desk. Do not write down your passwords or include passwords in emails. Tips to protect patient confidentiality, privacy, and security. Never look at a patient's record out of curiosity, even with good intentions. Follow the minimum necessary standard. Double check names and phone numbers before sending PHI by fax or email. Log out of your computer if you have to leave your workstation. Never share passwords. Familiarize yourself with the organization's notice of privacy practices. Recommendation. Having international and national health informatics standards in place is essential, but healthcare organizations must translate them into security and management practices for people's health information to be protected.